fantastic job both of you have. Just truly educated us so much further than where we were. What he is telling us is just a completely remarkable experience, because this is probably like the first year that anyone has offered to put together, I mean, a very organized, exceptionally driven by all of these organizations to provide free genetic screening. And that's what I'm hearing. And can you clarify so everybody can
Yes.
hear everything?
Yeah, we have kind of a quiz, which is sort of a simplified version of ALDA. It doesn't try and say which LGMD subtype it thinks you have. It just says, do you look like you are likely to have one of them? And then, okay, that's good enough. We'll get Maduri's lab to do the sequencing for this 30-some genes.
When will that become available?
This fall, probably.
Okay, that's wonderful news. So, how many people do you think that this could help? Like, I mean, would there be hundreds of patients that could get sequenced then?
Well, just as an experiment, we have on the order of a couple hundred patients in the U.S. Who we have genetically confirmed at the Jane Foundation with 2B. So that's maybe roughly 10% of LGMDs. So, I mean, it should be thousands of people. Now, probably Maduri isn't going to be the only person in the country doing this sequencing, but there's a number of people who start to have symptoms each year, and so once we have them in place, we can make the road much easier for people who are starting to have symptoms now than it was for those of us who started to have them a while back and had to wait for the gene to be discovered. Yeah.
Do you have any questions for either, Chuck?
Yeah, a couple of questions. I'm Chuck Hunt. I come from the myotonic dystrophy community, and I'm pretty active in that group. And so this idea of reaching out and testing and getting everybody organized is really a big push now, because drug companies are interested in rare diseases. And in fact, we have been able to start clinical trials with a product that may have some benefit to our community. So it's pretty important. And the idea that you got 150 participants in a short period of time in your study, I've been working with a project. It's taken us 5 years to find 60 patients that fit our bill. I mean, of course, we may have come across a few extras, but they didn't fit our parameters that we were looking for in this project. So it is good to put your name out there and offer yourself to be a participant. Now, one question I have for you guys that have this, if you propose the testing of genetic screening that's a lot broader, who actually owns the data that's created? I, for instance, am a multi-generational myotonic dystrophy, father confirmed, daughter confirmed, but I haven't been tested because of insurance issues. But in this case, I know where I lie in the spectrum. But who owns the data if they do all this testing and later on they say, okay, we're going to cut this group off to this insurance opportunity, and this group can go on to the richer insurance opportunity. So that's one question. And then, have you guys had any experience with insurance companies demanding that you get them genetically tested?
Okay, let me take the second question first. So the Jane Foundation, is a nonprofit organization, and we're, funded through, the benefactors primarily the Jane family that started the foundation. We have never dealt with insurance companies. What we have offered up to now is that, you know, people who, based on, you know, their symptoms or medical records, we thought were likely to have LGMD2B in the US, we would offer to pay for sequencing of the dysferlin gene ourselves. So, you know, essentially, that was a decision that we made early on. We realized that the insurance situation in the US can be very problematic, particularly regarding genetic testing, and we said, okay, let's spend some money on this, because otherwise we're never going to get enough patients genetically diagnosed in order to, you know, have any kind of a natural history study or a clinical trial. So, you know, fortunately, we're very fortunate in being able to do that. Now, in terms of the genetic, who owns the data, are you referring specifically to something with dominant inheritance that would appear in multiple generations?
Yeah, of course, my disorder is autosomal dominant.
Yeah.
So 50-50 chance, and so it's, you know, we're a high risk going down the road. And I was disappointed in looking at clinical trials, for instance, if they get funding from NIH, and not to be a conspirator theory type, but NIH funding says once you lose funding, all that data goes back to the National Institute of Health, and therefore you are in that big old database of that ugly possible government entity. So I just was curious about that.
Okay. Essentially, you know, by joining a registry, the patient does need to give, you know, permission for the keeper of the registry to have access to the genetic data. But what we do with the registry is that, you know, if there's a, you know, clinical study, or, you know, in the future when clinical trials start happening, we would contact patients that, you know, we think might, you know, qualify for that trial, and, you know, tell them about it, you know, make them aware of it. You know, it's obviously up to them whether they wish to participate, and we're not, we're careful not to twist anyone's arm saying you should participate. You know, you're not allowed to do that. But, you know, there is somewhat of a trade-off between privacy. If you want absolute genetic privacy, then you can't be part of a registry. So, you know, but if you want there to be a treatment, then you need to give up a little of your privacy to, you know, at least some people.